at our program, Hoag Sports Medicine, we have a motto that anyone can be an athlete and everyone should be an athlete. As an active lifestyle leads to a healthy lifestyle, our goal is so that all of our patients can maintain active and healthy lifestyles. You don't have to be a professional athlete to receive professional care. And so our goal here at Hoag is to make sure that everybody has top-notch care for their orthopedic needs. So at the risk of sounding like an infomercial, I'm going to go ahead and start off the presentation. So again, my name is Dr. Eugene Yim. I'm a primary care sports medicine physician. And my role with the LA Chargers is as the head medical team physician. I help supervise all of the medical care for the players on the Los Angeles Chargers football team, as well as their coaches, all the family members, and all the staff on the team. Part of that role is a game day coverage. So I'm at all the games for all the NFL games that we have for the LA Chargers. You can see a photo there of a recent incident that we had at one of our games. And so it's very important to have our coverage at those games to make sure that the players are able to compete in a healthy and a safe environment. However, I'm not alone in this. The NFL at every game has a tremendous team of physicians that help every game to care for their players. On the left side here, you can see that there's nearly 29 total staff at every NFL game that are healthcare professionals caring for the players who are competing. This includes 4 athletic trainers, 2 from each team. It also includes primary care physicians such as myself. There's usually 2 to 3 per team and per sideline. Dr. James Ting is one of my colleagues who's been working with us, and this year we were fortunate to have Dr. Ray also join our team as well as a primary care or a general medicine team physician. Our purpose on game day is to help with any concussions, any head injuries that occur, any bodily injuries that occur apart from orthopedic injuries. And so our game day presence is critical for those reasons. We also work with 2 orthopedic surgeons, Dr. Dave Gazaniga and Russ Petrie at Hoag, who help care for the orthopedic injuries and the surgical needs for the team. Every game also includes a neurotrauma consultant. So each sideline will have a neurologist or a professional who's trained to diagnose and help treat concussions. In addition to that, we have other clinicians, such as a dentist on site. We have an ophthalmologist. We even have an airway physician in the case that a player is no longer able to support their breathing on their own. There's actually a board-certified anesthesiologist or emergency medicine physician who's on site to help with emergency airways. So as you can see, it takes a whole team to take care of a team. And a similar concept we have also replicated at Hoag. So just like it takes a whole team to take care of the NFL, we at Hoag realized that it takes a collaborative team to take care of our patients. So our 3 physicians here comprise the main physicians at Hoag who care for the sports medicine patients that come into our hospital. But we collaborate very closely with a number of programs across Hoag because we recognize that there has to be holistic care for our patients. So we focus day to day in our clinic on the non-surgical orthopedic injuries as well as concussions that our athletes and our patients, our active patients experience. But we also collaborate with a number of programs listed here. And I'll highlight a couple of them just to show you the importance of some of these programs. We have a close collaboration with the Hoag Functional Medicine Program. You can see Dr. Cambria Judd pictured here. She has joined Hoag as of a couple years ago and is on site with me at Newport Coast at a clinic. And she is helping to spearhead a program in functional medicine, which is a field of medicine that looks towards integrative health, so combining nutrition with health coaching, with root cause disease analyses to make sure that you're casting a broad net for every medical issue, whether it's orthopedic or not. So we lean on her very closely, and also really appreciate having her as a part of our team taking care of our patients. We also have the Hoag Lifestyles program based out of Foothill Ranch, where Dr. Ray is located. It's a unique program where there's a nutritionist on site, as well as a health coach, an athletic trainer. They have a biocircuit on site at Foothill Ranch. And so their approach there is that every injury also requires nutritional support, also adequate support from a health coach when there's goals in terms of losing weight or meeting certain needs nutritionally. And then also the athletic trainers who help on the strength and conditioning side. We also have our partners in physical therapy with ProSport on site there, which help establish a pretty comprehensive program for our patients coming through that site. That's just two of the many institutes at Hoag that help us. Just to go back to the initial slide here, we have plenty of referrals that we will have towards the Neuroscience Institute with all of our concussions, which Dr. Suchy will be focusing on. There's the Hoag Orthopedic Institute with their numerous physicians who help with the orthopedic surgeries that are necessary for some of our patients. The Jeff Carlton Heart and Vascular Institute, which help with a lot of our cardiovascular evaluations, making sure that the cardiac fitness of our athletes is adequate. And then obviously Hoag Radiology and Hoag Lab, which help with some of the diagnostics for our patients. So as you can see, we work as a team here at Hoag. I'm so blessed to be a part of a team at Hoag where we have numerous programs, numerous physicians, all with different perspectives, different areas of expertise that all work together towards the goal of keeping all of our athletes and all of our patients healthy. And I actually glossed over it, but the panel here today is representing our new program here at Hoag, Hoag Sports Medicine. There's 3 physicians here. We're all board certified in primary care sports medicine. And if you're not familiar with what that entails, all of us have our own primary specialties, mine being in emergency medicine. And then we've completed a fellowship in primary care sports medicine so we can also take care of non-surgical orthopedic concerns. And you may be surprised to know that 80% of orthopedic issues are non-surgical. So certainly the majority of orthopedic issues we're very comfortable and skilled to treat. With that, well, before I pass it on, I want to give a quick hello to my wife and kids, because I would not be here without my wife watching the kids and feeding them dinner. So I love you guys. I want to give you a quick hello as I hand off to Dr. Jeremiah Ray, who will be presenting next.
Hey, good evening. I'm Jeremiah Ray. I'm one of the other sports medicine physicians here at Hoag. And Dr. Yim and I were buddies back at Sanford Med School, and we went our separate ways for our training and got married and had kids at about the same time, and lucky enough to cross paths again and bring our families together, which is really nice. So I'm new to Hoag and new to the LA Chargers this year, but professional and collegiate and Olympic sports medicine is well in my wheelhouse. We trained at Stanford, took care of dozens of Olympic athletes, 49ers, Golden State Warriors, took care of a whole bunch of people. So we have lots of fun training and good experiences to bring to you personally. And that's a picture of me over at University of California, Davis, where I was the head team physician there for 4 years prior to coming down here. Took care of 25 Division I teams. about 750 athletes, and bringing that skill set to you guys here today. One thing that's cool is I was able to do a 1-year-long musculoskeletal and interventional diagnostic fellowship in ultrasound. And so one thing that I bring to this team here is just a real great leading edge diagnostic and interventional capability with ultrasound. So here's me doing a little scan there. A couple of points about ultrasound that I wanted to go over with you all. It's wonderful because it's real time. You can come in with an injury or a complaint, and it doesn't matter if you're a professional athlete or not. We all have joints and we all have bodies, and we use them to move around in this world. And if you have a problem with one area, we can use ultrasound to try and figure out what that problem might be. And the cool thing is there are a couple of advantages of ultrasound over other imaging modalities like x-rays and MRIs. For example, we can commonly see on ultrasound dynamic problems. So for example, if you have a tendon that's sliding in and out of position, well, if we get an MRI, we can only see that tendon in one spot. But if we're looking at your long head of your biceps tendon right in here, we can see if it's subluxing in and out, in and out. So the dynamic evaluation of ultrasound is really helpful for some of those diagnoses that we can't quite figure out. One thing that's really nice is we can really target the exact tissue planes that are symptomatic. So for example, on an MRI, you see a huge picture of a lot of different areas. But with ultrasound, we can actually figure out exactly where that pain is, and then we can identify that precise tissue that's giving you your symptoms, which is quite nice. And one big advantage is we can do real-time precision-guided injections. So here's an example of a needle coming into a biceps tendon sheath, whereas back before ultrasound, we would just have to kind of guess based on landmarks and try and figure out where the needle is. But here we can see exactly where the needle is, exactly where the medicine is going, which is just a fantastic advantage of ultrasound over other imaging modalities. I'm going to wrap up here briefly speaking about one of the fun things that we're bringing to Hoag and doing here now, and it's platelet-rich plasma. I'm a big fan of this. What we do is we use your body's own cells to heal injured tissue. So what we do is we draw blood off of your own arm, and then we get a nice big vial of blood and we spin it down in a machine called a centrifuge. I don't know if you go to county fairs, but it's a lot like the Gravitron ride. You guys know what I'm talking about? It takes 10 tickets to get on it, but it's good. It's worth it. So we spin it down. The heavy cells in your blood sink down to the bottom. Those are your red blood cells because they're so heavy, they have lots of iron. And then above them are the other cells. We have our white blood cells that fight infection, and then the platelet cells, which are our healing cells. They're very cool. They look like aliens. There's a purple platelet cell right there in the center of your screen, if you can see that. So those platelet cells, those are the repair cells of your body. Super cool cells. We inject them under precision ultrasound guidance into the damaged tissue. What they do is once they get there, they will actually release these little vesicles. They'll kind of deploy these chemical attractors. They're called alpha granules. And then on the fourth image, you see these cool fluorescent pictures. Those are your blood vessels. Those are human blood vessels, and they are completely lined with what are known as, I'll use bunny ears, stem cells. Now, stem cells is a bit of a bucket term. We don't actually have stem cells because if you're a biologist, you know that stem cells are omnipotent. You can turn into any cell in the whole body. But around our blood vessels, there are mesenchymal cell line precursor cells, or mesenchymal stem cells. That means they can turn into muscle, ligament, tendon, bone, cartilage. It's just so cool. So those platelet cells, we put them in the injured area, a tendon, the joint, something that has arthritis, something that's not getting better. We put them into that area. The platelet cells will release these alpha granules, and your mesenchymal precursor stem cells will migrate right into that area and lay down brand new tendon, brand new tissue. It's very fantastic. And ideally get you feeling fantastic and fit and ready to roll. So that's one of the things that we can do here with Hoag Sports Medicine. We can do diagnostic real-time ultrasound, we can do interventional ultrasound, and we can do some really nice regenerative medicine with our PRP injections. With that, I'm going to pass the mic on over to my colleague and good friend, Dr. James Suchy. He comes to us. He's actually a native. He's back home. It's feeling good for him. So he's returning home here, and he's just a great colleague and partner to have with us. He does a lot of our LA Chargers concussion care and post-concussion management. So I'm going to hand the mic over to him.
Hi, I'm Dr. James Suchy. It's nice to meet you all. It's a pleasure to be here and joining these two other fine physicians. Just to plug to Dr. Ray, he's doing some really amazing things with ultrasound. So I think it's absolutely incredible. And if you have any interest or questions in that area, he's definitely your person to talk to there. It's very exciting and interesting. Talking a little bit about myself, so I am actually an Orange County, California native. Grew up in the area, ended up going to medical school and doing my residency training at UC Irvine, so very close by here. And then took a little stint up to the Pacific Northwest, where I had the wonderful pleasure to take care of some teams up there, Portland State as well as Lewis and Clark University. Got the option or the opportunity to take care of a number of high-level runners, professional athletes with the Nike team up there. And I've had a lot of experiences working with endurance athletes in general. I have a special particular passion for working with just endurance athletes of all kinds. I come from that background myself, always having done running, cycling, rowing. So while I take care of all athletes of all different kinds, I particularly enjoy working with athletes from these backgrounds. I'm really excited to join the team, especially in terms of taking care of the LA Chargers this past year. My role in the team is actually as a concussion consultant. So basically that means that I'm taking on the responsibility of aiding and assisting in the evaluation of players who have experienced, unfortunately, concussions on the field. I provide management recommendations as well as recommendations about when they'd be appropriate to return to play. And I work very closely with Dr. Yim and Dr. Ray in that capacity. And I think that there's definitely application to the general population. We know statistically that most concussions don't actually happen during sports, and most of them occur outside of sports. So it's a very relevant issue for wide portion of the population, but definitely a big issue in the sports arena too. Even for people who aren't playing football, we can see it in all different areas. So if I move to my next slide, I'm actually going to play a clip here. This was actually a clip that, or an incident that occurred late last year. Donald Parham, if you were following the sports, actually suffered a concussion. And we're just going to watch the event so you can see some of the characteristics that go into this injury. And there's not going to be any sound, but if we watch closely at the touchdown area where he falls down, and if you just catch it right now, he's actually in what we call a fencing position at this point, where his muscles, he's not actually holding this position on purpose. His muscles have basically locked up. And after receiving the ball and hitting the ground, you see there was no contact with any player. But his head, when he went down towards the ground, actually whipped backwards when he hit the ground and created this traumatic force that was enough to induce the concussion and create that tonic posturing that we call fencing. At this point, we're skipping to the point where the team physicians have basically gotten in and involved. You might not be able to make it out, but they're basically applying a spine board, basically stabilizing the cervical spine, just taking all the precautions necessary, because in these incidents you don't know if there's been any additional cervical damage. You're also, ready and prepared in case there's been any cardiac arrest or you need to do any other particular intervention in this case. So overall, a very scary situation to be in. Unfortunately, that's sometimes happens in the sport of football. But that is sometimes how what can happen in these events, and concussions can occur this way. So we'll just let that play out. Perfect. All right. So I think that was a good introduction. So I want to talk a little bit like, what are concussions? So we hear this term concussions. It's been talked about for a number of years. We know concussions are basically mild traumatic brain injuries that occur from biomechanical forces, which basically means that there's some sort of force that's applied or transmitted to the head. So this actually goes in contrast to what a lot of people believe about what causes concussions. They think that only if you hit your head you can have a concussion. But we actually know the truth is that any force that's transmitted through the body and into the head can actually create an impulse that can affect the brain. And what basically happens is that the brain is actually, for lack of a better term, sloshing within the cerebral spinal fluid, and it's impacting the inside of the skull.
which induces the concussion. These are a list of the wide variety of signs and symptoms that we see with concussion. So as team physicians, we always have to be on the lookout for these potential symptoms. Not every player presents the way that Mr. Parham did. It's not always so obvious. Sometimes people fall down and they get right up right away, and they may feel perfectly fine for a few minutes or even sometimes a few hours afterwards. And they may only notice later on that they're experiencing dizziness, or they seem confused, or they're having other symptoms. So it's always important things for us to look out for. So these are oftentimes reported symptoms. We may also look out for other things. So if a player maybe appears to have balance problems, or is maybe acting emotionally different than they usually would, these may be warning signs that we look out for. And these are, important things that when I talk to, my non-professional athletes and parents and young athletes of all kinds, I'm talking about being aware of these kinds of symptoms. And I think that for the parents out there, as well as for anybody who's involved in a contact sport, it's important to be aware of these types of things. So if something seems off, whether it's someone you're exercising with, they fell and they hit their head, or whether it's your child, you're aware of these things to look out for that could potentially be signs of concussion. Another big question that oftentimes gets asked is whether or not you need to have imaging with concussion, so particularly like a brain image, like an MRI and a CT scan. So strictly when it comes to concussion, you don't actually need to have any brain imaging to diagnose concussion. And most concussions that occur don't actually need any imaging at all. Now, there are some circumstances where you may require needing a CT scan or of the neck or of the head to rule out other possible injuries. So sometimes what can happen along with concussion is people might fracture their cervical spine, which could be particularly dangerous. They might have a brain bleed, but this is not the most common situation, and in most situations, people don't need this type of advanced imaging. So I bring this up because I think a lot of people get worried and concerned that if they go to the ER, they go to the urgent care, and they get diagnosed with concussion, they're thinking, well, I have to get a head scan, absolutely, or I'm not getting the appropriate care, and that's not necessarily the case. And so there's oftentimes warning signs that doctors are looking out for, red flag symptoms, so to say, and doctors are trained to look out for these types of things. So it could be things like worsening confusion, headaches that are getting progressively worse. If someone seems, like they're completely disoriented, or someone who's completely lost consciousness and hasn't woken up. These are just one of a few symptoms we may look out for that may indicate that there's something more concerning going on aside from the concussion. This slide is just to illustrate what I want to say about how we take a very strong team-based approach when we're managing concussions. This goes for not only the professional football players that we take care of, but also for any high school or college athlete or non-athletic person that we take care of who has concussion, which is taking a very strong team-based approach. So concussion is not something where it's just an interaction between the doctor and the patient. There oftentimes has to be a lot of communication and interaction, especially for students who have concussions, between the team, the athletic team, the school itself, as well as the family life at home. So, without understanding education in these areas, it's very difficult sometimes to make progress and headway. Fortunately, as Dr. Yim was illustrating, we have a great network of different therapists that we utilize for various forms of therapy that may be required for concussion. We also have an excellent neurologic specialist. So if we need any neurologic test, any specific detailed neurologic testing, or specialty insight from any neurologist, we certainly can tap into that. And so we're very well equipped to take care of you got any patients that come to see us in the clinic, as well as the professional players that we see out in the field in a similar capacity. Right. And then this is to illustrate what concussion recovery tends to look like. So if you look on the right side of the screen, there's different stages that we're typically bringing people through when they're recovering for concussion. And it's similar between whether you're a professional level player or you're, an amateur athlete, right? So we're starting oftentimes with a brief period of rest. We don't, back in the, in the old days, you may have heard, put somebody in a dark room and don't let them do anything until they get better. We've learned better from that. We've realized it's actually not conducive to rapid recovery. We may have someone rest for the first 24 to 48 hours, but oftentimes after that time, we're trying to reincorporate that person back into activity, and the same thing goes for our players. We're trying to get them to do some light cognitive activity. We may have them go back and do a partial day at school or work and increase that over time. And very early on, we're implementing light physical activity. So there's actually studies that show that utilizing physical activity, but in very light forms in the early stages of concussion, can actually be beneficial for recovery. So going on a light walk, doing some light aerobic exercise can be very beneficial. And as we get better and as they improve, we'll incorporate other types of increasing levels of activity, sport-specific and then non-contact training, up to the point that they're ready for what we call a medical clearance. And at that point, they're consulting with a physician like myself or Dr. Yim or Dr. Ray for that final approval for them to return back to full contact play. And another question that I tend to get is oftentimes, how long does it take to recover from a concussion? Does it take months? Is it a long time? The good news is that for most people, concussions will recover fairly rapidly over the course of a few weeks. Now, that may not seem very rapid, and that can certainly have a detrimental impact on people's lives, both school and work-wise and sports. But for a lot of people, the average length is, for most adults, is typically a couple weeks. We do see some situations where that can last longer, but those tend to be less common. And then, the last thing I wanted to talk about was just how do we prepare for concussions? Concussion hasn't happened. We're trying to get, our patients, our amateur athletes, our high school and college athletes, and our professional athletes ready, to avoid concussions. And these are the stages this is the preseason assessment steps that we go through, and we're preparing our NFL, Charger players for, each season, and that includes education. So we're talking with them about all these things that I mentioned to you, the signs and symptoms to look out for. We're doing a full history review and examination. So we're reviewing how many prior concussions they've had before. We're doing a neurologic baseline test for them to determine are there any potential neurologic deficits that they might have going into the season, just to get an idea of what it's going to look like when we examine them later on. And then we'll usually utilize neurocognitive tests. So these may be paper or computerized tests to actually help get a baseline or an idea of what an athlete or person's baseline cognitive function is, so that when the time comes, if they do experience a head trauma or injury, we can do a post-impact test, and we can compare that to their baseline test to help us in decision making on whether or not they have a concussion and also when they're ready to return to play. So that about wraps up my portion of the presentation. We're actually going to transition to some question and answers right now.
We got some questions. Do you want to lead it off there, Dr. Yim?
Of course. I
All right.
love questions. Let's see. Oh, here's a good one. So for Dr. Yim, what is functional medicine? You had mentioned that in the presentation, and how does it relate to sports medicine? So functional medicine is actually an approach towards medicine where you're looking at the root cause of disease as opposed to just treating the problem. So the theory behind functional medicine is that every medical issue has a cause. And so rather than just prescribing a Z-Pak to somebody who's coming in with a cold, you take that time to think about, why is that person getting a cold? Are there nutritional issues? Are there psychosocial issues that are contributing to that person getting sick? And so this approach towards medicine has been developed over the years. There's actually a functional medicine institute now, specialized training and credentialing that goes into that process. And Dr. Judd, who's joined the Hoag family, is developing a program around that. Some people compare it to integrative health, so it's a newer version of integrative health. At the end of the day, I think it encapsulates how we as sports physicians are aware that in the realm of orthopedics, you have to consider a holistic approach that involves nutrition, that involves physical therapy, rehab, preparations with strength and training, understanding how stress, sleep, all of these things influence the injuries that we treat. Good question.
Excellent. I got a good one too. This one says, for Dr. Ray, can an ultrasound-guided procedure save me from a surgery? And the answer is, it depends, which is kind of a cop-out, I'm sorry. But there are times for sure in which we can get people feeling significantly better with minimally invasive office-based ultrasound-guided procedures. A couple of examples. One of the best ways to treat golfer's elbow or tennis elbow, also known as lateral epicondylitis or medial epicondylitis, is with ultrasound-guided injections. Also, a great way to release nerves that are entrapped. So, for example, carpal tunnel syndrome, we can improve the outcomes, functionality, and pain significantly with an ultrasound-guided injection to help release some of the scar tissue that's going through that carpal tunnel so that that median nerve can then move and glide and become less symptomatic. Same thing goes for other areas of nerves around the body. A big one that's really satisfying is where the brachial plexus comes out and can get pinned under these neck and shoulder muscles. That's called neurogenic thoracic outlet syndrome. And we can go in under ultrasound guidance and help break up some scar tissue and free some inappropriate adhesions away from those nerves to get them to move and function normally. So yes, there are instances in which ultrasound guided procedures can save someone a surgery. Sometimes surgery is the best and most highly recommended route. For example, if someone has an ACL rupture, the vast majority of active people just are more functional and less painful with an ACL that's intact. Only way to fix that I like is with a surgery. And so surgery is an amazing thing in many instances, but ultrasound-guided procedures can save us from some surgeries.
Right. So I'll take the next question, and this is a particularly good one. So the question is in regards to concussion, and it's, does having a concussion increase my risk of future cognitive decline or dementia? So this is something that we didn't always have the answer to. But as more research and information has come out, we've actually learned more about this topic, and we've actually found that the answer, in short, is actually yes, it does. And that there actually are studies that can quantify this. And one statistical study found that actually having 2 concussions doubled the person's overall risk of having cognitive decline or dementia in their lifetime. And the challenging thing about that is that this doesn't necessarily mean that they're going to experience this acute decline immediately after the concussion or as a segue after the concussion, but this could occur many decades later on. So this is sometimes a challenging thing to talk with my patients about, because when I'm talking to young athletes who are maybe more concussion prone, and we do see that there are some individuals out there for one reason or another, whether it's their genetics, their biochemical makeup, or maybe the technique and the way in which they're playing the sport, they just seem susceptible to having concussions over and over again. We very often have to have these difficult conversations with the players, as well as with the parents if they're very young, to decide whether or not it's safe for them to continue playing these sports. And there's no hard and fast rule about how many concussions is too many concussions. But it's on a case by case basis. We have to make that decision together to decide, weighing up playing the sport versus the overall long-term cognitive health of the individual. Conversely, you take someone who's, maybe over 65, maybe someone who's in a geriatric age, and having a fall, an injury, and suffering a concussion sometimes can set off cognitive decline that otherwise wouldn't have been there, even if that person recovers from the concussion, or maybe they never fully return back to the cognitive baseline that they were at before. I have seen that happen before, and it's one of the important reasons that I talk with people a lot at the age about fall mitigation, reducing risk of fall, and that goes on a lot with what Dr. Yim was saying about how do we look at the whole person, how do we focus on good nutrition and working on strength training and balance so that we can reduce that risk of injury for the individual and help someone live as long a healthy life as possible.
Got some more questions I'm going to ask Dr. Yim.
Oh, what a treat.
That's good. Dr. Yim, you want to field one?
Sure. So this is, I guess, for the group. I'm happy to give my first shot at it, but somebody asked, what are your opinions about partial meniscus tears? Yes to surgery or hold off? Use PT? For how long? So for those of you out there who aren't aware of what a meniscus is, which I didn't really know what one was either until medical school, everybody's knee has two crescent-shaped pieces of cartilage in the middle of it, the medial meniscus and the lateral meniscus. And they help to buttress the knee and provide cushion for the knee. And occasionally with an injury, usually a twisting type of mechanism, the meniscus can tear. Now, that's one mechanism of how these tears occur. More commonly, just from a percentage standpoint, these tears can be degenerative. So it's important to classify the type of tear because all meniscus tears are not the same. An acute meniscus tear in an 18-year-old is very different from a meniscus tear that you would see in an 80-year-old who has bone-on-bone arthritis. And in both cases, you would call that a meniscus tear. So in general, the answer to this is not all meniscus tears need surgery. If the tear is acute, meaning it just happened and there was a specific injury, more likelihood surgery may benefit the person. If the tear is causing mechanical problems, if it's causing the knee to lock, to buckle, to give out, other reasons to consider surgery. If you've tried non-surgical treatment. So for most patients who come in with a meniscus tear, I will recommend giving a trial of injections and physical therapy, seeing how the symptoms level out after a few months before deciding on surgery. So that's my shot at the answer, unless you guys have some additional.
That's fantastic. You nailed the highlights. I think the other part is whenever we have an injury, doesn't matter what the structure is, over time, the nerves that send big pain signals will begin to recede a little bit. So the natural history of small or partial tears is that they just do get better over time. And one of the nice things about physical therapy, and people often wonder, well, what is the magic about physical therapy? Why is that a common route? The common reason we like physical therapy is to help correct biomechanical deficiencies. There's also something that happens anytime you injure a joint. Because we're mammals, all mammals have this protective mechanism known as arthrogenic muscle inhibition. Big fancy talk because we like to sound smart. That basically means if you hurt a joint, your brain turns off the motor units, the muscles that control that joint, so the joint can heal up. So physical therapy is really great because it helps waken up those muscles again so that they work normally. When you have the muscles working normally, the joint is happier and the injuries will hurt less. So oftentimes if it's a small tear, I really try to get people to do a good course of physical therapy and see where they land. And then if they're just not getting better, gosh, surgery is really helpful for a lot of those cases. Do you want to go next? Do I want to go next? Is it my turn?
Yeah, you want to take...
Dr. Ray wanted to.
Oh, all right, I'll go. So this is a fun one. This is a total panel one. I love talking. I'll take all your cards. That was good. So what is your expert advice for the lifelong athlete? So this will be fun for all of us.
Yeah.
I think we all agree on, we have different ways of phrasing it. The phrase I use is movement is medicine. Oh gosh, I think in American fitness, the recovery phase is commonly neglected. When we're with the Chargers, gosh, we'll do a 2-hour practice, and it'll be a light practice. Those guys will be in the training room for an hour, hour and a half doing soft tissue work, stretching, foam rolling, using their percussive massage guns. And so you see them really working the tissue planes. And I'd say for the lifelong athlete, actually for everybody, just stretch. Please just stretch after your activity. It doesn't have to be extensive. I mean, no joke, if you do 30 seconds, 60 seconds of stretching, that's better than no stretching. What happens is all of our muscle fibers and all of our tissue planes in our body, they're meant to glide independently of one another. And it's like if you have a box of dried spaghetti noodles, they all glide independently of one another. They'll kind of rock back and forth. But if you work out really hard and you don't do the appropriate recovery, stretching, soft tissue work, you can kind of get those tissue planes gummed together. Stretching, foam rolling, those massage guns, massage. This is a good excuse to go get a massage, right? All of that helps break up those adhesions and helps your muscles be healthier, more functional, and less prone to injury.
Yeah, I think that's a really great way to illustrate it. I would offer up, just to piggyback on that. What is my advice that I talk with a lot of patients about being a lifelong athlete and keep maintaining your health is, has to do with exercise. And I tell patients, just keep moving. That phrase, if you don't use it, you lose it, really rings true. And I think that when you're staying active and you're living an active lifestyle, which we know has so many benefits to your overall health, and I always encourage patients to do it, there's going to be injuries. There's just no way around it. No matter how much you stretch, no matter how much soft tissue work you do, it's going to happen to everybody. Things are going to happen. There may be falls. You may have sprains. You may pull a muscle. But the thing I tell people is that, just accept that this is going to happen. And remember that there's always other forms of activity that you can do when you're recovering from that injury. So, I see some people who they love the sport that they do, they love the activity that they do, and they don't want to do anything else. And I think that it's unfortunate because when you're recovering from one injury, you could be maintaining your fitness and you could be maintaining cardiovascular fitness and strength in other areas of your body. So the thing that I always encourage patients, let's say if they fracture their ankle or they're recovering from a stress fracture or a sprain or something that keeps them from, say, running, for instance, I'm telling them you should start doing other types of exercise. So I know maybe you're not passionate about swimming, maybe you're not passionate about aqua jogging, maybe you're not passionate about lifting weights, but these are other forms of activity that I think you can do, and that can kind of scratch that itch, because I think a lot of athletes want to do some form of physical activity in some form or another. And it makes you more prepared so that when that injury does recover, you're ready to come back and you're not facing a big decline in your fitness level because you sat at home for 6 weeks for this injury to get better. So keep moving, whatever way you can, find a way to move and stay active.
For the record, I am passionate about aqua jogging, just so you know.
Yeah, he's a world champion aqua jogger, actually, in another life.
I believe it.
That's good. Dr. Yim?
All right, I'll ask this question, and this is thrown out to all of us here. For the older lifelong athlete, what's your stance on supplements?
Ooh, that's a big one.
That's a tough one, yeah.
Mm-hmm.
So I can start off with that and say that my general stance on supplements is that I think that my impression is that the vast majority of supplements out there on the market are not necessary. I think that a lot of it comes down to good marketing, and there are some circumstances and some instances in which I do recommend some patients trying various supplements. Two that come to mind: vitamin D supplementation is a very common one that I'll recommend for patients. I think even in beautiful sunny Southern California, many people are vitamin D deficient, and we know there's a host of health benefits that go along with maintaining normal to higher vitamin D levels. Another one that I recommend, depending on, if someone's following a more vegetarian or vegan diet, and I do have some athletes like that, is recommending vitamin B12 supplementation. For most of my athletes, I'm also checking, especially female athletes who are menstruating, will check iron levels, and that may be a supplement that we include as well. Those are some of the more common supplements that I'll include. Now there may be some that I may recommend patients try if they have degenerative joint disease. Anti-inflammatory supplements like turmeric, glucosamine and chondroitin are other common supplements I'll use. But that's more on a case-by-case basis, and I don't recommend that to everybody to use universally. I don't know if you guys have any other ones that you commonly will recommend.
Yeah. Those are the major ones. I guess my comment about this would be that there can be precision involved. I think a lot of the supplement world is based on marketing, as you mentioned, and there is the option to have precise approaches towards this. And that's where the partners in functional medicine, for example, have it really down, where if you're concerned someone's B12 deficient, why not check their B12 level? Who would have thought that would have been helpful, right? Mm-hmm. So there are physicals that we perform at Hoag, and your physicians at Hoag are certainly capable of sending off micronutrient evaluations with the B complex vitamins, iron levels, calcium. And so if you're not deficient, there's really no purpose in supplementing certain things. And so there are a number of tests that you can have to measure and quantify and also figure out the appropriate dose for you. For joint supplementation, I don't typically recommend patients to try glucosamine or chondroitin or other supplements, only because the data is not there yet. The science hasn't proven clinical benefit to these supplements. Glucosamine chondroitin being the one you hear about most, and that has the most data for it, and even that is equivalent to a water pill, essentially. So I think the injectables that are out there now and some of the ultrasound-guided procedures, which are more targeted and localized, to me make more sense for degenerative disease and for arthritis. And there's a lot out there now that we have at our fingertips for that.
That's good. I'd like to echo Dr. Suchy's comment on food-based supplementation, right? If you have a fantastic diet, you're not really in need of a whole lot, but there are specific instances. Probably the two that I would add to that is my vegan athletes. I'll have them take a collagen peptide supplement as well, just to make sure that they're getting a lot of those peptides to help build muscle, tendon, all of that. The other thing is with concussion and head injury, I will recommend omega-3 supplementation. Two pretty solid randomized prospective blinded trials in humans looking at concussion recovery with omega-3 supplementation. We seem to have better outcomes with that. But if you have a really heavy fish-based or marine-based diet, you're probably in the clear on that one as well. So that's where the precision comes in.
Mm-hmm.
I think you're up, right?
I'm up, yeah.
All right.
So I have a question here, and we can throw this, even though I'm the self-professed endurance doctor, we can definitely throw it out to the whole team. So does any member of your team have experience with a lifelong runner who has received a pacemaker? So talking from my experience, I have not taken care of a runner who specifically has a pacemaker, but I can broaden that question and say that in general, as sports doctors, we're very experienced working with athletes who have a variety of different chronic health conditions, even cardiac conditions as well. And it'll depend specifically on the condition itself, and we can make determinations about what types of activity and the intensity of activity that's appropriate. And that may even involve us being in some communication with your cardiologist or whichever specialist you're working with. But that's one of the beautiful things about seeing a primary care sports doctor, is that we have this background in general medical care, and so we can provide guidance in regards to activity in relation to any other chronic illness or condition that you have.
Yeah, that's good. Am I up? You're up?
Why don't you go?
I'll go?
Yeah.
This is a good one. This will be for the panel, but I think it'll be pretty simple. Do you also treat athletes for physical exams, or is it limited to a problem-focused visit? And the answer is we see everything for just about, we'll see everybody for about everything. So if you need a sports physical, come on in. We'll take care of that. Concussion evaluations, we'll take care of that. If you have exercise-induced rashes, which is a thing, we can take care of that. So we can take care of all of your sports-related issues. Personally, I also have a bit of a performance clinic, and so if you want to come and see me as a primary care provider, but your primary goal is optimizing your life through dietary, sleep habits, exercise interventions, and kind of the precision-guided micronutrient analysis to try and make sure you're firing on all cylinders, that's something we all are comfortable doing and that we do routinely. So come to us for all of your needs related to being active, I would say.
Mm-hmm.
Yeah, I echo that, and I also, as part of my answer to the question about my advice for a lifelong athlete, is that we are here to help. So my advice to every lifelong athlete is find a really good primary care sports medicine physician that you trust. Our approach is non-surgical. Our approach is preventive. I think a lot of patients have the fear that when they see the doctor, they're all of a sudden going to be told you can't run anymore, you can't, lift weights. That's not our goal. Our goal is to work with you to make sure that you live a healthy life, but you also stay as active as is safe for you and as active as you want. So that's my advice, is that, there's 3 great physicians here, but there's physicians all across the country that are out there with the goal to keep you healthy.
All right, so next question here. When do we see a sports medicine doctor versus a PCP, or should we always get a recommendation from our PCP? This is a good question. So it's kind of highlighting, I think, what distinguishes, your primary care sports doctor from your general primary care physician. And I would say that there are definitely, even primary care doctors that maybe don't necessarily have the sports medicine title. Some are very experienced, and have a lot of years of experience taking care of athletes in different forms. So it's definitely on a case-by-case basis. I think that, if you are someone who knows your PCP and you've seen them for other injuries before, and you've maybe felt like maybe you just want a little bit more information, you'd like a little bit more input. I think that those are areas where maybe seeing a sports medicine doctor like one of us could be beneficial. Alternatively, if you have a very good relationship with your primary care doctor and you've turned to them before, for sports issues, and they provided you with good guidance before, you feel like, then you could certainly turn to them first, and there's nothing wrong with that. I mean, we all serve in some primary care capacity, and so we work very closely with primary care doctors, and so I think that it depends on your relationship and how comfortable you are approaching them for these things.
Well, great. We want to thank everybody again for your time joining us today. And unfortunately, even though we're talking about lifelong athletes, this is not a lifelong presentation. We have to cut it short at some point. Again, I want to thank the 2 physicians here who are joining me here for the panel, as well as everyone who's joined us today. Please know that Hoag, all the physicians at Hoag are here to help you. We're certainly here to help with any of your sports needs, but through the network at Hoag that we have, any concern you have, we can certainly help connect you to the right people and specialists who are here to keep you healthy. So with that, we're going to end the...
Can I say goodnight to my 4 kids
Oh,
really
please.
quickly? It's bedtime. So good night, Rosie. Good night, Mimi. Good night, Torin. Good night, Callum.
Good night.
Nice.